Hey, welcome. Are you just so tired of that constant sniffle, that stuffy, runny nose that feels like a cold that just never ends? Well, you're in the right place. Today, we're going to finally demystify what's going on and build you an action plan to get some real relief.
You know the feeling, right? You're asking yourself, is this just the world's longest cold, or is it something else entirely? It's been weeks, you're feeling drained, and it's just so frustrating. Well, let's get to the bottom of it.
All right, so let's dive right in. We're about to uncover the real culprit behind those symptoms that just won't quit. And believe me, it has a name, and just knowing what it is, well, that's the first huge step toward feeling better.
And here it is. The culprit is called rhinitis. It sounds kind of technical, but all it really means is that the inside of your nose is inflamed. And that inflammation, that's what's causing all the trouble. The stuffiness, the sneezing, that annoying postnasal drip. So yeah, it's not just a cold, it's a specific condition we can actually manage.
And you might be thinking it's just a stuffy nose. But honestly, the impact of rhinitis is a much bigger deal than you might think. It can absolutely wreck your sleep quality. It can give you that fuzzy head feeling where you just can't focus. It can tank your performance during the day, affect your social life, and it's even linked with asthma. So getting this under control is about way more than just breathing a little easier.
So, how do you figure out what's really going on? Well, this is where it gets interesting. Think of your pharmacist as your personal symptom detective. They're trained to ask all the right questions to help piece together the puzzle of your specific case.
And every single question they ask is a clue. Seriously, they're not just being nosy, I promise. They're building a really detailed picture of what's happening with you. Your symptoms, your history, your triggers, all to get to the root cause of your rhinitis.
So, the first batch of clues is all about your symptoms. They'll ask things like, when did this all start? And is your nose more stuffy or is it super runny? Is anything itchy? And a big one, how long has this been going on? Is it all the time or does it seem to come and go? Getting these details right is going to help narrow things down a ton.
Okay, next up, the detective is going to dig into your history and your triggers. Does anyone in your family have allergies? Do you have asthma? Do you notice that you feel worse around certain things, like pollen, dust, or maybe even just smoke or strong perfumes? And this one's huge. What have you already tried to make it better? All of these clues are absolutely vital for figuring out the right plan for you. So all of this detective work, all these questions, they lead us to this really important fork in the road. Because you see, rhinitis isn't a one-size-fits-all problem. It really boils down to two main types, and figuring out which one you have is the absolute key to getting the right treatment.
And this is the core question we need to answer. Are your symptoms being driven by an allergy, to things like pollen, dust, or pets, or are they a reaction to a more general irritant, like a change in the weather or smoke? Your body reacts differently to each, which means the solution is different too.
Okay, let's break this down. On one side, you've got allergic rhinitis. Think classic hay fever. The big giveaways here are intense sneezing and itching in your nose, your eyes, even the roof of your mouth, plus those watery eyes. Now, on the other side, non-allergic rhinitis is usually dominated by a really blocked up nose and that lovely postnasal drip. Itchy, watery eyes are pretty uncommon here. Can you start to see where your symptoms might fit?
And here is a fantastic tip, a really big clue. If you've ever taken one of those modern, non-drowsy antihistamines, the kind you can get over the counter, and it actually made you feel better, that's a super strong sign that you're dealing with the allergic type. It's a key piece of evidence in your case.
All right, the investigation is done. Now for the good part, your action plan. Let's talk about the practical, real-world strategies you can use to finally take back control and get those symptoms managed.
And the best part is, the approach is a pretty simple, logical three-step plan. Step 1 is just avoidance. It's your first line of defense. If you know pollen is your enemy, check the pollen count before you go out. Easy. Step 2 is irrigation. A simple saline spray or rinse can feel amazing. It soothes everything and literally washes out all the gunk and irritants. And finally, step 3, if you need more help, is to talk to your pharmacist about the right medication.
And see, this is where all our detective work pays off big time. The medication isn't random, it's targeted. For instance, if your symptoms all point to non-allergic rhinitis, the kind driven by irritants, then an intranasal corticosteroid spray is probably going to be the most effective treatment out there. This is exactly why getting the diagnosis right is so important. Okay, now I really need you to hear this one. This is a critical warning. A lot of us grab a decongestant spray when we feel stuffed up, but if you use them for more than just a few days in a row, it can actually make your congestion worse. It's a real thing called rebound congestion, and it's a trap you definitely want to avoid. Look, your pharmacist is an absolutely fantastic resource, but it's also super important to know when your symptoms need more than just a pharmacy visit. So let's quickly cover the red flags that mean it's time to see a doctor.
If you have any of these, it's time to make that call. Things like a fever, any signs of infection like serious facial pain or thick colored discharge, if your asthma symptoms are acting up, or hey, even if you and your pharmacist just can't get a clear picture of what's going on, these are all signs to escalate your care.
And last but not least, remember that this is a process, not a one-time fix. Once you and your pharmacist agree on a plan, especially with the new medication, make a note to check back in with them in about 4 weeks. That follow-up is so key to see if it's working and to figure out the next steps together.
So, now that you're armed with all this knowledge, are you ready to stop just putting up with it and start taking control? Your pharmacist is right there, ready to help you investigate your symptoms and build a plan that works for you. Why not take that first step toward breathing easier today?